Hi, good evening. Austin Mayor Steve Adler. Sorry I'm late getting started tonight, 7:08. We had a city council meeting today, put some items on the May election. Came from the community. One relates to changing when the mayor election is held and campaign reform and some other stuff, strong mayor, adding another council district, but also the citizen petition about the camping ban, also potential change for oversight on policing. But anyhow, we're past that now, and today's Tuesday, so it's a big data dump night. And we can talk about some of the stuff that is present and in front of us. Let's begin with the dashboard that we always begin with, so we can take a look at where the numbers are. Let's see. We will look at the key indicators for staging, and you can see the number of new admissions. 7-day moving average is 53. That's well under the 60, where we could consider going from red into orange, go from stage 5 to stage 4. 52 was the actual admissions today. 7-day moving average was 53. Dr. Escott felt that was a really good sign. Looked like we were owning the fact that the numbers were coming down and moving out of red. He paid particular attention to this 9.4 number. You'll recall that the positivity rate in our community was 12.4 in the dashboard you've been seeing over the last week. This is a really good sign that the virus is not going from person to person as much. This could be the result of more people wearing masks or more people distancing. Number of new cases today, 346, below the 7-day moving average. For all of these reasons and more, Dr. Escott went ahead and moved us today into orange, stage 4 alert. We'll talk in a second about what that means, but you can see the numbers have come back down. We're going to go to now the other dashboard so that we can see. Let's look here in just a second. We're going to share the screen, bring in the other dashboard. And you can look at the number of people that we have hospitalized in our city right now. 446. The 7-day moving average is 462, so we're below that. 39 people in the alternate care site. That's part of the 446. In our ICUs, 133. The 7-day moving average is 137. Ventilators, 96. 7-day moving average is 94. Number of people that have, let me see here. Look like yesterday's numbers. Let's look at this again. The number that are hospitalized. Here we have the numbers for tonight. Let's make sure that I still have you here, and I think I do. The number of people hospitalized, 424. The 7-day moving average is 462. So significantly lower. ICUs 132, 7-day moving average 137, ventilators 94, which also happens to be the 7-day moving average. People that have passed away, 695. That's 6 more people than yesterday. So what we're seeing is a mortality rate that is still high, even though the other numbers are coming down. That's the kind of way that we see things. Cases go down. The next thing that goes down are admissions, then hospitalizations, ICUs, ventilators, and the last number to really start going down is the number of people that are dying. It's such a large lead time. So 6 more people dealing with someone who has passed away. But the number is slowing down, as we talked about a second ago, so we have changed the risk level that we're under. Let's take a quick look at the University of Texas dashboard, the modeling dashboard. If you recall that yesterday we were about an R factor of about 0.86. They have redone the dashboard at this point, and you can see that the number has gone down to 0.75. So that's a lower R factor number. That means that the epidemic is probably not growing at this point. We have significantly fewer infections now than we had just 7 days ago. You can see this aqua line, which is the future projection, is pointed down just a little bit more than it was yesterday. That's hospital admissions, hospital census pointed down, and the ICU patients. Remember, not too long ago, January 16th, we were 182, real close, these numbers getting close up to the 190 we were at on January 12th, but the numbers have started to come down. The modeling show ICUs going down even more than that. Let's take a look at the Dr. Escott's dashboard so that we could see what those numbers are showing us. And we'll pull up the tab here. We'll get the slides from, whoops, that's the UT thing here. Let's try this again. We'll stop this. We'll share the screen. Let's see here, Chrome tabs, and then the slides from Dr. Escott. Let's start up at the top. These are his slides from today. Number of new cases, confirmed cases. The yellow line is the 7-day moving average. The blue line is the daily number. New admissions headed down. This is the chart that has hospitalizations, ICUs, and ventilators. Number of new hospitalizations going down dramatically. That one happens first. ICUs catches up, but this is already headed down. Ventilators pretty much flat. But if these numbers continue to hold, we're going to expect this number to start trending down as well. Regional Infusion Center, we just note again for somebody who qualifies, we put 546 patients through the Regional Infusion Center. Thank you to the state for helping us provide the trailer that this takes place in, as well as the folks that are staffing it. We have the capacity to do 90 people a day. This is for the monoclonal treatment for people if they go here relatively soon after catching the virus, before it's been with them for too long. But it pretty significant assistance in helping people to avoid hospitalization. This is the treatment that the president got, and we have more capacity than we have people right now. So if you get the virus, or friends get the virus, or family, make sure that their doctor investigates whether or not this regional infusion center would be a good thing to do. This is a picture of the alternate care site that we opened up in the convention center. It has capacity up to 50 right now, but obviously capacity to expand well beyond that. Patients come here referred from the hospital only after they've been stabilized. It's low acuity patients. 64 people have been treated and discharged, 39 as of yesterday. And we know from the dashboard that we were looking at just a little while ago that we have 36 people in there right now. Let's compare Austin to other jurisdictions. TSAO is the state emergency area that Austin is a part of. It's a lot bigger than our MSA, but the number of folks, the portion of people in hospitals in that TSAO area, 10.67. When that went above 15% a few weeks back for 7 days, that's when, by the governor's order, the occupancy in restaurants and bars went down. You can see what it is in other cities. Houston at 15.4, El Paso almost 18%, Dallas almost 17%, San Antonio almost 16%. Their numbers are going down too. You can see El Paso went up a little bit. Dallas went down, San Antonio went down, but still Austin is better. This was the UT numbers from yesterday. You saw the more recent numbers at the beginning. I've got a minute here. This is hospitalizations by age group. You can see the older age groups, the numbers are coming down, which is good. Of some concern in this middle group, which are the kind of the middle-aged people, 20 to 50. In that age group, numbers starting to go up here in 40 to 49 and here in 20 to 29. So we have to continue to watch that. These folks probably, generally speaking, are not going to have the same kind of serious situation that leads them to hospitals at the same rate, but we still have a lot of these folks in our hospitals, and folks in this age group are in fact passing away as well. They can also infect other people. This is the youngest age group here, relatively flat, a little bit of an increase in the youngest group. Here it is by age groups again. 400 people in the hospitals this week compared to 344 this week compared to 400 last week, which is why we've changed the risk level. 73 to 54, 83 down to 70, 87 down to 59. Till we get to this middle age group, it's 53, 53, 27, 43. So this is where we're seeing that uptick. This is hospitalization by race and ethnicity. Troubling statistic here, the percentage of people in our hospitals, the white, not Hispanic number has gone down, but the Hispanic number has gone up. It's gone up to 42.4, 42%, up from 39%. Really, if it's proportionate to the population, we're down here at roughly 36%. So this is a concern. We'll talk about the demographic concern, especially with respect to vaccines. We'll get there in just a moment. We talked about it last night with a new dashboard. But you can see other folks, African American, relatively flat, but still at 11.5, significantly higher than its percentage, that community's population, which is about 7% in the community. This is hospitalizations by race and ethnicity, 372 down to 314. The reason the numbers are different than the one we saw a second ago is we don't have race and ethnicity for everybody, and some people just don't disclose. We've gone from 142 down to 133, 175 down to 128 among the white non-Hispanic population. The Hispanic population, even though it's a higher percentage, still went down from 142 to 133, but because the total amount went down at a lower rate, the percentage went up. This was the important slide. This is the one that talked to us about positivity in the city. Going down to the 9.4% that you saw on the dashboard. We were at 12.7%. You can see that it was this many weeks ago before we were in this range in positivity. And again, we're trying to get to below 5%, and certainly maybe even down to 3% is really what we're trying to get to in the city. Even though the numbers are going down, even though we've gone to level number 4, we can't relax. This is positivity by race and ethnicity. You can see green to green. All these numbers have gone down, lagging us here, still way too high as an outlier, Hispanic, Latino community. This is the same positivity by age group. Each one of these blocks is a different week, and you can see that generally speaking, positivity is going down in all the age groups as well. Positivity in school-age children: high school 13.9, middle school 12.8, elementary school 8.1, preschool 7.3. Just to gauge, these are positivity among those folks that are tested that we see. In just the general population, the number would be significantly lower than that. 254 cases of the virus in the area school districts. People that were near close contacts, 1,600. That's why we're still watching the schools. That's why we're still a little cautious in schools, and why it is that if we can lower positivity and transmission in the community generally, we'll have a better chance of being able to keep schools open. This is the flu chart, the regular influenza. Remember at the beginning we were talking about the twindemic. We wanted to avoid having COVID-19 and influenza happening at the same time, competing for hospital beds. At the very beginning of this, back October, when this chart first started, we said, hey, let's stay under 2% for influenza. And you can see we've managed to do this. This is what the numbers were in prior years. One of the reasons why it's down probably is that we're wearing the masking. Here we are with respect to the risk chart, having gone from red up to orange. The significant differences is that capacity. So we really only wanted people to do curbside service, both in restaurants and in retail. But now we've gone up to 25 to 50% occupancy. By state guidance, restaurants and retail are allowed to go even higher than this, up to 75%. But Dr. Escott's urging caution. If you're going to go into some of these places, a store, a restaurant, be outside the restaurant if you can. And better to be in restaurants that look like they're only a quarter to half full. Travel, is supposed to still avoid non-essential travel in this orange area that we're in right now. But you can now do social groups of up to 10 people. We were trying to avoid any kind of gatherings outside of the house at all, but in orange, going up to 10 works. Hey, if you're a high-risk individual or you're at home with a high-risk individual in your house, even in orange, the rules are stricter. Don't go out and avoid shopping and dining unless it's essential. Don't travel. Keep your groups down to just really the people that you live with. That's if you have a high-risk individual that's in your home. Here are the stage 4 recommendations. High-risk individuals stay home except for essential travel, such as buying groceries. That's high-risk individuals. Everyone should limit non-essential travel in the orange zone. Hey, keep the masking going, keep the 6-foot distance going. Businesses, now you can go to them. Don't have to just do curbside and delivery, but try to stay with those that are not packing very many people in, say just a quarter to a half. And Dr. Escott's advice to schools is limit attendance. These are parents and fans and that kind of stuff at sporting events. Limit attendance to the players, the coaches, and the parents. But other than that, let's not have big groups that are coming into that area. Let's talk for a second about the vaccines that we have in the city. CDC guidelines say, and they have now extended the window for people getting the second dose of Moderna and Pfizer. Remember when we started out, we were saying that it was 23 days and 28 days. They've looked at the data, and that's not a strict rule. Right now, CDC is saying that really up to 42 days you can go ahead and get the vaccine. Let's also talk about vaccine efficacy continues to improve with time following the vaccine administration. So what this means is, say, vaccine efficacy on the first dose. That was 50.8% after the first dose and into those same 14 days. After those 14 days, and assuming you only got the first dose, the efficacy is up to 92.1%. Total efficacy in those receiving just a single dose, 80.2%. So you can see that the preliminary indications are that even one dose is going to be really effective. But the reason that we're not relying on this at the national level and just saying to everybody, just get one dose and let's get everybody first dose, is because those trials involved a relatively small number of people. So we're continuing to get the second dose, but know that you have, up to 42 days, probably more, but at this point, up to 42 days to get the second dose. Here in That's what was concerning Moderna's second dose. Again, Austin Public Health vaccine eligibility flow chart. If you're a healthcare worker, you are eligible right now. If you live or work in a long-term care facility like a nursing home, you're an essential caregiver worker, you are eligible. Those are 1A people. If you're over 65, you're eligible. That's a 1B person. If you're over 18, but you have a medical condition that makes you susceptible for the virus, you're also 1B. Know that we have over a couple 100,000 people that qualify. In fact, in our city, we have over 100,000 people that are just over age 65. We have 12,000 people over 80 that have not gotten the vaccine yet. And we only have 12,000 vaccines that we're able to give out every week. We looked at the dashboard yesterday. We've given out 31,251 by the last time it was counted. We've continued to give someone since the last dashboard was done at the end of last week. And really we're over 40,000 vaccines given, and we were also giving out vaccines today, so the number is going to be even higher than that. We're giving out the vaccine in roughly proportion to the demographic of people over the age of 65, which is 68% white, 18% Hispanic, 7.5% Black, 5.1% Asian. That's about what we're doing in terms of the vaccine that we're giving out. But everybody recognizes that that is not good enough, that we have to do a better job, even when we're giving it to people over 65, of giving it out to the people over 65 that are in our most susceptible and vulnerable populations in our community. We have to get a higher number of actually vaccines for Latinos, actually have to do a significantly better job with African Americans. Their number is low, like 4.5%. In terms of actual vaccines given. Director Hayden Howard was in front of the city council today, and the entire council was pushing her on this issue. She understands it. She says she's working on strategies right now, recognizes that that's something that has to happen. They've set up a call center partnership. They're calling people, especially folks 80 years of age, especially those that don't have internet access, to help people register, to help people schedule appointments. We're also trying to train 311 staff to serve as ambassadors. We're trying to make it so that a lot of the questions that people are asking when they call into the nursing line, they can get without calling into the nursing line, because we're finding that that service is backing up, and it's not able to get everybody everybody that doesn't have computers, doesn't have access. So we need to free up those nurses so that they can do that more of that kind of work. So Austin Public Health is doing that as well. What about vaccines? The state is recommending that we should wait until the vaccines are received before we schedule appointments. And that's what the city of Austin Public Health is doing right now. There are a lot of people that are saying, hey, schedule me for my return trip in 4 weeks so that I know the date and the time. Austin Public Health is saying we don't know for sure that we'll actually have it at that date and time, which means we're going to give you a date and a time, but we might well have to change it. They don't want to do that. Create that expectation. So what they're saying is wait to schedule the appointments with people until the actual vaccine is in hand. That's when people can go online and get those appointments. That's the same for both first and second doses. They're going to just make appointments on Tuesdays and Thursdays. They're going to give advance notice to, advance notice to people that are 80 years of age, to give them the opportunity to get in line first, to schedule those appointments. Again, remember, there's like 11 or 12,000 people just over 80. That's not including the people over 75 and over 70 and over 65, or people that have comorbidities, those other kinds of conditions. Know that when we open up time slots, they fill in about 2 hours. And we have now just received 12,000 vaccines for another first dose, and we are waiting for and expect to get imminently the second dose vaccines. If you get the second dose vaccine a few days or a week late, it's not going to impact the effectiveness. We talked about that just a second ago. APH will reach out to you. If you've gotten the first dose with APH, they will reach out to you to help you schedule for your second dose. So don't worry about that. You're not going to lose your second dose. We're committed to get those people who received their first dose will receive their second dose from APH. APH gets a second dose for everybody that got a first dose earmarked for that person, but that's how the system works. So if you got your first dose from somebody other than APH, you should be getting your second dose from that very same entity. It'll come from the state to them to be able to do that. But you can't get a second dose from Austin Public Health if you didn't get your first dose, because we're only getting second doses for the people that we gave the first doses for. Continuing to move forward with registration system enhancements, the design, the layout, the notifications, and the like. We know that that can be glitchy at times, so we're working to improve that. And we're also working on mobile vaccines and home referrals to make sure that we can get the vaccine to folks that might be homebound in our city, to make sure that we're getting it to the people most vulnerable and least able to get online and then sort their way through that system. What to do while you wait to get your second dose? Make sure that you're registered. You'll get contact if you're 28 days past your first dose. Look for emails, texts, or phone calls from Austin Public Health, because you'll be notified to get your appointment. And if you are told, hey, you're notified, go get an appointment, and there's not an opportunity when you go to schedule, that's okay. Again, Austin Public Health will stay with you and around you to make sure that you are getting that second dose. Those were all the slides and information that we had. Tomorrow, Wednesday, we'll come back here again for another Got a Minute. You all take care, be safe, and good night.